Hello and welcome to the Happy Healthcare Professionals live show. It's a really, really special show this week because I've had two lives this week, which is great. Normally we run this show on a Wednesday evening at 8 o'clock. And if you're new to watching me, maybe you were watching on LinkedIn or on Facebook or on YouTube and all the places, and you have not come across this show before, then let me introduce you to the Happy Healthcare Professionals live show. It is a show designed to really invigorate and excite you about your careers, whether you are a pharmacy professional or any healthcare professional. I'm Kamal. I'm a pharmacist by background. I am a former national level pharmacist turned career coach and business strategist for pharmacy professionals. And I absolutely love helping pharmacy professionals to create impact in their communities and really do so by changing their careers and doing work that they absolutely love. So this show is no stranger to interviewing lots of amazing pharmacy colleagues, and I have a guest today who is just such an amazing colleague. I've met her over the last few months and she's just so inspirational. And today we are going to be talking about a subject matter that probably doesn't get talked about enough. And I'm so excited to explore this with her. If you are joining us live, then do say hi in the comments and let me know that you are here. And if you're watching this again on the replay, then drop a little hashtag replay and let me know that you're watching then. And let me know what your comments and your suggestions and your feedback is on this live show. So let me introduce Minna. Minna is a pharmacist who I honestly am so inspired by. She has literally taken her pharmacy degree and she has run with it, and she has explored so many different areas. But the thing that really stands out for me for her is that she is a pharmacist on a mission, and she is deeply, deeply passionate about sustainability and the planet. And she is an incredible clinical pharmacist. So I'm going to bring her on screen because I'd like her to introduce herself to you guys. Hi, Minna.
Hello, everyone. Hope everyone can hear me well.
I can hear you perfectly fine. And Nada's joined us. Hi, Nada.
Hi. I'll just quickly do a brief introduction then. My name is Minna and I am a hospital pharmacist currently based in the Northeast region. Qualified about, I would say 6-7 years ago now. I did my pre-reg when it was the old modules, so different from all the pre-reg modules currently. So been a pre-reg tutor as well in other time, rotated around the hospitals, worked in a hospice, worked in the eye infirmary, did a bit of everything, did locum community pharmacy the last 5 years as well. But then I thought I wanted a new challenge this year. So I kind of didn't pick up any more locums and started working for NHS 111 and in kind of a different role, but kind of similar to Acute Medicine, which I'm currently in, working, doing ward rounds with the consultants and medical team and working closely with the nursing team as well. So that's a bit about me and the background. And like Kamal says, huge interest in working on sustainability in pharmacy, which stem from my personal interest in how can we as a human being be more friendly to our planet, and how we can work collaboratively, bring people on board, speak to people in a manner that not necessarily tell them how it is, but kind of make them aware, make them understand and come to an understanding of what they can do and make an impact themselves, which aligns to their values and principles of how to live a secular life.
You know what? I'm so glad that you are talking about this because, I think, we've come across each other recently, and I'm honestly so inspired by everything that you do, because you really just have taken the reins of what your pharmacy degree has enabled you to do, and you're pursuing work that you feel so passionately about. And like you, I am a big believer that we do need to support the planet, that we need to do that in a sustainable way. You may or may not know, but I am trained as a holistic health coach, and so that's something that I feel really passionately about, and I'm a big believer in lifestyle medicine and the impact that can have on our health, but the impact that can also have on our planet. And I would love to hear about, how did you get into this space? What is it about sustainability that we're not doing well in pharmacy, or is not quite there in pharmacy?
So to begin with, I think it's yeah, I think there's a bit of a lag. Sorry. I was just saying, and to begin with, personally, how I got into this myself is a couple of years back, I was in London and I visited a photojournalism in a natural history museum. So went along with my friends, got a ticket, and there was a section on kind of what we are doing to destroy the planet. And I remember vividly standing in front of this photo of this turtle. Like it must be older than me, older than all of us, 100 odd years old. And there was just this plastic, the rings where beer packs come in, the plastic rings that was tied and just cordoned off his neck. And there was blood. It was just a sad photo of it next to a discarded lounge chair next to it on the beach. And I think I just started crying in front of everybody. And I just thought, why? Why is this happening? This is human action. This is humans that did this. And there was, following the photos was just horrifying. It was legless frogs in a pond where in France, because that was one of the famous cuisines. And I again just thought, why is this happening? So and then it got me thinking, what can I personally do in terms of having to work harder in terms of understanding what personal impact I have that led to this, because these plastic came from somewhere, and the habit of eating animals and as a result damaging the planet happened somewhere. Began reading books, began attending loads of webinars, and educate myself really, and found a lot of professionals, if you like, healthcare professionals, in fact, on Twitter that are advocating for the same thing. Started following them, and whatever links they have, started reading the journals, the data, the scientific, because as pharmacists, we know we want evidence-based. We don't want to just blindly follow what people are saying. I want to know what the data is. What's the science behind this? Is this scientifically backed up what you're saying? Climate change is impacting health. So educated myself on that, and followed a bunch of people, and luckily founded a group of pharmacy professionals. So Tracy, the founder of Pharmacy Declares, is amazing. So she gathered a few people together and started having meetings once a month, full of knowledge, and they've been advocating for climate action for years, longer than I have, and have done personally incredible things in their own lives. So started from there, and so pharmacy is the third largest healthcare professionals in the United Kingdom. We have a lot of impact in terms of what we can do and how much audience we can reach, and then from there audiences as well. It just cascades. Got us thinking, what can we start doing? So people began having conversations with our leaders, because leaders what can cascade it down. And so then there comes a time where we need to grow bigger. So it happens to be the Royal Pharmaceutical Society election. I thought, yes, this is the perfect platform. Everybody will be watching what happens in the election. People that doesn't really normally speak or appear in pharmacy will suddenly appears and wants to have an opinion. So I thought, great, this is an excellent platform to promote sustainability. So my whole campaign of election is based on that. So my statements have been published in the Pharmaceutical Journal. And I think that picked up a lot of interest in terms of the green movement, started off a lot of green movement. And Tracy behind the scenes then worked with the likes of UK CPA and got them to declare a climate emergency. So saying that pharmacy professionals should be working on how to reduce waste, how to live more sustainably, and divest from fossil fuels, because the money, we pay a lot of membership money in our professional life. And do we actually know where this money go to? Who does it fund? Does it fund a bank? Do you bank with a bank that pays towards investments in the fossil fuel industry that contributes to climate change? So look into that. So there's different levels of things that people are looking at and doing. So yeah, I've rambled on there a lot because it is an area of passion that I've held for the last few months, since the election. Work has just come, like endless work has just come leading up to the United Change Climate Change Conference happening in Glasgow, November this year. There's a lot of people wanting to do stuff before then to showcase what we're doing to help the greener NHS meet net zero target, and what we can do collectively, not just individually. We want to bring people along as well, how we can make them understand the urgency and act on it.
You know, the thing that comes to mind to me when you've just been talking is we talk a lot about waste in pharmacy, right? And we talk about waste from the perspective of the medicines waste, right? And yet there is so much that, that's just one tiny aspect of the impact that medicines as such have on the planet, right? So let's talk about that actually. What kind of measures and what kind of things are you putting in, are you trying to put in place through Pharmacy Declares to try to encourage, because we have to start with ourselves, really. Climate activity doesn't actually start with us talking to talking to patients and talking to individuals about it. It actually begins with us, right? So how are you guys getting through to, to pharmacists on the ground and saying, what can you do as an individual? Or here are the things that you could do as an individual.
Yeah. So I think the first step, the key really, is to make everyone aware and education. So we're calling for education and leadership in this. So we have got people speaking with the General Pharmaceutical Council and try and get them to incorporate sustainability and environment impact of medicines in the pharmacy degree. Because it's not talked about at all in my degree that I did, zero. So we're also working with different organizations to get pharmaceutical industries to recycle the blister packaging, the plastic packaging, the cardboard boxes, because you need to be responsible for the waste you produce. And there is a lot of medicines that we use exactly like you said. And I have attended a webinar recently with green prescribing. So we always talked about, if your blood pressure is high, here's a ramipril, here's an amlodipine. But have we actually thought about healthy lifestyle advice? I know everyone knows what it is, healthy lifestyle advice. And patients will think, oh my God, here she goes again, talk about my weight, talk about how I should live my life. But maybe if you train people to speak or coach them or mentor them in a way to make them want to take responsible for their health and stop smoking. And have you thought about how that impacts your children when you do smoke and how they view you when you're smoking? And your blood pressure is high. How's your diet been? What do you mainly eat? Maybe you should reduce the salt content, because evidence show that it's linked. Do you use fizzy Cocoa, do you buy fizzy drinks? So simple conversation like that to get them thinking. So the first line we should be thinking about is not adding a tablet, not creating waste. because as the hierarchy go, reduce, reuse, recycle, we should
Yeah.
always aim to reduce where necessary. And so some of the work that Pharmacy Declares are doing is working with there's just so much work at the minute. I'm just trying to ramble my brain. So I was just speaking to one of the pharmacists in NHS Lothian, who is amazing, who's built these tools and metrics in calculating anesthetic gases, trying to mitigate nitrous oxide in theatres. And then it got other people in a group thinking how they can act in their own trust, how they can get in touch with people who knows about how to do that. So I think it's kind of, you inspire each other. So it's not necessary we have to have all knowledge. As long as we have a group of people with the knowledge sitting there, you can always bounce it off each other. And personally, whenever I've been trying to speak about sustainability to people, I get a bit apprehensive on what the reception is. And recently, I've been invited to speak in the Northeast Senior Pharmacists meeting, where there is the chief pharmacist in every trust in the region. There is the lead CCG pharmacist in the region, and I was a bit like, oh my God, this is the girl who's talking about climate. But there has been so much interest since they are actually all wanting to see what they can do in their own trust in themselves to make an impact in pharmacy, to reduce our waste, to make pharmacy more sustainable. I've never seen like that reception before, and it was really reassuring that I am on the right tracks and what I'm advocating for, what I'm fighting for, and I really want to pursue it even more, because I know I'm not just talking to a wall. So with reception like that, so sometimes you do feel alone in this, because like I said, it goes back to number one. If people are not aware and they're not educated on the subject, and they think it's in something that's going to be happening in 50 years' time. So the climate news recently has been really depressing. So we see pictures of floods in Germany, Luxembourg, China, and there's also countries that don't get talked about with flash floods currently in Lagos in Nigeria. So another panel that I've been speaking on was the Health for a Green New Deal movement. So we talked a lot about ending fossil fuels use, but it's such a huge lucrative industry. You can't just make everyone redundant. You can't just say, we're stopping this now, everyone's switching over to electric vehicle, bye. So there's a lot of healthcare professionals who's championing this Green New Deal, which started from America, really, to get people in that industry, the fossil fuel industry, to maybe think about retraining in renewable energy industry, to get people more aware of what they can do in their own companies, who are doesn't have a green plan, if you like, and bring people along to maybe come up with a plan. So if they're producing this much carbon, how do we counteract that? In the United Nations meeting recently with the G7 summit, they talked about carbon trading as well. So there's a lot of work out there in terms of carbon reduction and carbon emission. And I think information is out there. We just need to let people know, for starters, and direct them to where you can find the information. It's a bit like what pharmacists are doing. I don't have to know the whole BNF. I know where to find the information, medicines information. It's what we do. So I know this causes this. Let me find a policy that says that. Let me find the evidence that says that. It's pretty similar.
Yeah. Do you know what? That's such an important lesson, actually, that, you know, one thing that's come to mind when you've been talking about this to me is it is about educating ourselves, right? And then acting upon that education. And in a way, we're used to doing that as healthcare professionals. We're constantly educating ourselves. We're constantly learning about conditions, and there's new evidence emerging all the time that we like to keep ourselves abreast of. And what you're saying is the planet is the same. There's, we have to take ownership of the education ourselves. And I think as pharmacy professionals, we're in a really, really key position, right? We talk about, you've talked about the fact that we're the third largest profession, but we're a key profession in terms of not only setting the example by making changes ourselves, but also as a trusted healthcare professional who is there to educate the public. And that is where I feel like, we have an opportunity to not only, because if you look at your own self, you'll be able to tell, when you read all the data. I've changed my diet massively over the years, right? I've gone from eating meat fairly regularly to eating meat once a week, if that, to, increasing my plant intake, to being much more conscious about the waste in my household, to being much more conscious about how much I'm using my cars. And if COVID has taught us anything, it is that awareness of our impact on the planet, and I think I remember that very first day when we went into lockdown and just opening the windows and hearing the birds. I live in North London, so it's really busy and there's lots of cars. And, it was that silence was palpable. And, and now I think back to that silence and I think, I wish I could go back to that silence and just hearing the birds, but it's made me so much more conscious and aware of how I'm using my car, for example, and the awareness has got to come from us, but we have got to constantly educate ourselves. And the other thing I find is we've got to constantly remind ourselves to put the planet first, because as we know, old habits die hard. And, we have to keep talking about this and reminding ourselves of how important our individual impacts can have.
Definitely. I think as well to back up with that belief or changing your habit, because like you say, all habits die hard, and it's really, really hard to change your habit. And the comments I've been reading in terms of climate advocacy and news are, why should I have to change my ways? I'm happy with the way I'm living. Why to change my diet to save a few penguins? And that just shows the lack of understanding. So if people understand the impact that they have, that can contribute to it. So you've mentioned COVID there. So we know after floods, extreme flooding, we know that comes waterborne diseases. And we know with COVID, says it come from bats. And if you think we're constantly cutting trees down, deforestation, where are the bats going to go when all that is gone? They're going to come nearer to humans. They're going to come nearer to cities. Not just bats. What other diseases are out there that we don't know about, that's coming closer to us when we're destroying nature? And people have to make that link. We are causing this. We are causing the animals that are living happily out there in their nature to come closer and bring whatever they have that we might not know about closer to humans and have that impact on humans. So I think 100%, like once people are aware, then you would do the things that you just listed. What can I do personally? And then you have that conversation with people around you and trying to make them understand. I think the key thing for me for this journey as well is I get frustrated when people don't understand. I just think, I've told you once already, don't put plastic bag in the bin. Like, we're reusing things in this household. Why do you not understand? So you can't have that attitude, because people get defensive. People say, I don't know what your problem is. I just did that and that was convenient for me. Why did you want me to go out of my way to put this in to recycle? So So I think the attitude you have in talking about climate. So I attended the Royal Society of Medicine webinar on Tuesday, and there's an amazing speaker, David Pension, and he's based in the University of Exeter. And his work a lot is how to educate people to speak to others about climate change. And this is one of the things he said, that you can't just talk at people and put the data in their face. It's a bit like I compare it to, you know, mask wearers and non-mask wearers. Why should I wear my mask? It's all about my freedom. But when people can make that link on, and if they want to make that link and educate themselves on why people are still wearing masks, then people would be more considerate. But then it also links to the moral pillars, if you like. So I recently listened to the Oral Apothecary podcast, where I bought a book. It's called The Righteous Mind. I'm trying to understand these people who doesn't listen to, or not interested in educating themselves on climate change. I'm trying to understand why. So I bought the book to read, and trying to understand how I can not change their mind, but bring them along. Even if they did little things, and just little minor changes, that's a huge outcome.
Yeah, absolutely. I wanted to come to Mihira's comment, because she said, completely agree, we have the responsibility and the opportunity to be the change needed. Our professional strengths gives us the opportunity to align our responsibilities holistically. And I'm a real believer in this. I wholeheartedly believe in this, that, it is about, when I talk about, living holistically, it's about having that conscious awareness, right, of not only yourself, but the impact that you can have on others, and being aligned to what you believe in, what you believe is right for the planet. I don't think anyone would disagree with the fact that we need to care about the planet and we need to look after the planet. It's as you described, it's how you meet people where they're at and bring them along on that journey. And, I think it starts with, as going back to what you were saying right at the beginning about having that evidence base as the backing, and us as professionals, as healthcare professionals, who believe that the only way to sustain the human race ultimately is by taking care of our planet, and, coming together and building a force for good to try to do that is one of the best ways, I think, that we can do that. That coming together and really, us putting our hands up and saying, and I don't think there's any shame in us in people. That's the thing that I don't want people to feel like there's shame around your habits that you've had up until now. There isn't. It's about that awareness. And once you have that awareness, you can take steps, and you have to take those steps in a fashion that is comfortable to you. Because as much as we would love everyone to completely change their lifestyles, and I can't say that mine is 100%, sustainable at all.
I can't. I still drive, not in an electric vehicle, and I have to drive to work every day.
Exactly. And yet this is where I think it can get really lost. The conversation gets often lost in the world, because it's like, you're talking about this and you're doing X, Y, Z, and it's like, but I'm taking steps forward. And that's what we need to be showing people, that we're taking those steps forward, that we are taking responsibility for the planet, and we are taking responsibility for the planet through our own actions. And by doing so, if we collectively are doing that together, then that can only bring benefit to the planet.
I think it's that do good factor, isn't it? If people can feel that do good factor, and the community collectively together come and do good, that just is amazing. Because everyone, you get that feeling that everyone's on board, wanting everyone to do better. And there's the thing that I wanted to bring up recently as well in the group. that mentions the term ecocide. So a lot of places are making it law now. So in Australia recently, a bunch of your youths and children are asking the government to take legal action on the sustainability matters that they're championing for. And a lot of activists, if you like, and leaders are looking at making people aware through legally that you are killing people by not living sustainability, thinking about your waste. So there are data out there on, I don't know how much do you want me to go into this, but the global north are killing the global south. So a lot of people, United States, United Kingdom, China, but above the equator, heavily invested in fossil fuels. And the people who suffer are people below the equator, in poorer country who hasn't got adaptation resources to mitigate the risk for floods, etc., heat waves. And interestingly, there are a lot of links, because in our chat before with Rena and we were talked about racial injustice, and climate change is linked with racial injustice, because if you think about the skin color of people in the global north versus the people with the skin color of the global south, these people are, and women as well, they talked about women in drought having to go further to find water, to cook, to wash, to do laundry in these areas. So there are a lot of data out there. It depends on what, like I said, aligns with your values. So I mentioned those because I really value inclusivity, so equality and women's rights. So I read into that and got even more involved, because to me, those are what I value for. So I think it's up to people to find in these little details, what aligns with you, what do you stand for, and when you have that, people will come on board. So it doesn't matter what I believe in. I can tell you all about it, but you need to go read up yourselves and find what you want to stand for, what you want to fight for, and then when you have that, a change will come.
Yeah, and what resonates with you,
Exactly.
right? You know, the impact on every single person is slightly different
in
terms of, you know, what's really going to shift them, you know, and it's got to be a shift that really affects your core, affects who you are as a person, right? And it's whatever that connection is, and start there, right? Whether it be that you're a believer in healthy lifestyles, and so, you know, you're starting with what goes on your plate, or whether it be that you believe that, you know, the air is really affecting people's, people's, lung disease, and so, you know, maybe you have a child that has asthma and you live in an area where, you know, pollution's really high, then you might start off with walking instead of taking the car, you know, and all those sorts of things. And I want to come back to kind of in the pharmacy space. If I were to say to you, right, as a pharmacist, what is the number one or two or three things I can do today to help support the planet? What would you say those things are?
So personally, if you want me to ask you personally, what I've been doing in number one, I look at people's medicines every day on acute medicine and think actually what I can de-prescribe. And I ask for honesty in my patient consultation. So, for example, we know patients want to say, yes, I've been taking this just to satisfy healthcare professionals. I've been chatting to them in a way to make them say it's okay that they don't take the tablets. Then I formulate a plan from there. For example, I know people don't take their Adcal D3 chewable tablet. They taste horrible. They taste like chalk. I say to my patients that, oh, do you actually take these? Because they taste like chalk, a lot of people say. And then you get the honesty to go, oh, actually, I don't. I haven't taken it for months. So then you start with there. Change the way you speak to patients, and then change their relationship with their medicines. it's okay you don't take 10 tablets. What 5 that I can keep you on, or nothing even? Or how can I change things that's happening in your life that would make you comply with the medicines? And number 2, waste management really is a huge issue. So in the NHS Green NHS document, 20% of medicines contribute to the carbon emission in the NHS, and waste. There's a lot of waste is in a different section, the direct contribution. So
that's massive.
20% is massive.
That's huge. Yeah, that's huge.
And 3% of that is inhalers, and 2% of that is anesthetic gases. So a lot of pharmacy organizations are currently being tasked to do metrics on how much PMDIs they're using, how much of Desflurane they're using, and how can you be better. And in order to be better, you need to speak to various different people, stakeholders, and educate them as well on why you want to change. So again, bring people on board. So a lot of conversations behind the scenes are being had at the minute, and work being done. If you go on the Future NHS forum, there's a lot of work that has been done, and a lot of healthcare professionals advocating for these as well in primary care. They've done a lot of work in terms of researching and speaking to pharma companies themselves on how to be better in terms of prescribing which ones. And the third thing I would say is, and just be open-minded and listen to and be receptive to change. I think pharmacists, especially when it comes to following guidance, we're straight to the point. So, for example, if the policy says I have to, I can't reuse this, or this has to be discarded, it's been out the pharmacy. But really, when you look at the situation, for example, if the medicine's left the pharmacy, been on the ward, it's sealed, and it's just come back to the pharmacy, things like that. So don't blindly follow protocols. So in terms of, I don't know how. So this is controversial. During the pandemic, there's like the reuse of controlled drugs for patients in hospices. Can we do something with that? And in America, I think in the military bases, they are looking at using medicines past their expiry date. To pharmacists here, it'd be like, oh, no. But really, why not? What is the evidence base of the degradation of the medicines past a month, past 2 months? So things like that, just start thinking and be more receptive to change, if you like, because we're not very good at deviating out of protocols and guidelines, if you like. And in terms of nomad trace, so for ease, people just give them one plastic pack every week. Can we maybe reuse somewhere, but get a solid one? Got 2 trays running, one to send out to the patient, bring the other one back, and you just use 2 tray a year or 5 years, like. But there's people who argue the sterility of that, how clean is it in the tray, and it's been out the pharmacy. But people are doing that already. People who are on board with what they're doing in terms of sustainability work have been doing that and are on board with that. But how do you get the other group of people to do that as well? So yeah, I think it's, like I said, it goes back to being aware, receptive to change, and then people will want to do their part in this.
Yes, such important lessons. And I think, you've really, I hope that people watching this really get inspired to learn more about sustainability and their personal impact, and start thinking about, how we can, as individuals, and as healthcare professionals, really challenge the status quo when it comes to sustainability, and say, and really ask those difficult questions. Is this right? Should we be doing it this way? And looking at the data, you're going back to what you were saying about just now about, using the reusable, dosette boxes instead of, having throwaway ones. What's the data? what's the data that shows us that actually it's right or it's wrong, you know? So, you know, if a patient has been using it for a year, you know, if multiple patients have been using it for a year over, what's the data that tells us that it's the wrong thing to do? You see what I mean? And I think that's really where we start to kind of like challenge the way in which we operate, and
Yeah.
you know, really start to think about, okay, well, how can we make this more sustainable? And I think it's happening. You know, I think people are aware now. They are starting to make those changes. And you know, I thank you so much for everything that you're doing, Minna, in, you know, in promoting sustainability in pharmacy and starting to talk about it, you know, at regional, national level, and you know, really starting to help us as a profession to think about our impact.
Yeah, yeah. I mean, I happily talk about this to anyone, anywhere, anytime. So, but in terms of the nitty-gritty of things, I would say I'm not even the best person to speak to. There are a lot of people out there doing amazing work already, and I like to connect people with people, and
Yeah,
then the magic happens. So I don't have to know everything. You don't have to know everything. We just have to start the conversation somewhere, and then
yeah.
things will happen.
Yeah, we just have to start the conversation somewhere. Thank you so much, Minna, for your time. I really, really appreciate it. Thank you so
Thank you
much
for
for sharing. And you know, I can't wait to learn more about this, and you know, and really help play my part as well, and you know, and help educate as well as much as I can. So thank you.
Thank you for having me.
Pleasure, absolute pleasure. So that was Happy Healthcare Professionals live show today with Minna Eii about how pharmacy can really be part of the solution when it comes to sustainability and, you know, taking care of our planet. And, you know, I could continue this conversation for ages if I wanted to. But thank you very much, Mahir. Mahir says really interesting conversation. But I'm going to have to go. So thank you so much for joining me. If you are watching this on the live, on the replay, then drop me a little hashtag replay. Let me know that you watched it. Let me know where you've watched it from. Let me know what your biggest takeaways have been. You can find me, and I forgot to mention that, you can find Minna on LinkedIn, on Twitter, and I will share all of her handles on this live, so you can contact her if you want to talk more about sustainability and the planet with her. And just as a reminder before I go, I am going to be running my LinkedIn masterclass for pharmacy professionals, which is happening on Monday night at 7:30 p.m. All the details are on my profile. I would love to see you there. I'd love to see you, supporting you in your profile, on really making those connections on LinkedIn and creating careers that you absolutely love. So thank you so much, and I will see you next week. Bye.